Okay, good morning everyone. We'll make a start now. So thank you ever so much for joining us this morning. I hope you're all well. This webinar forms part of the national evaluation for the Fulfilling Lives programme, which is funded by the National Lottery Community Fund. And this morning's webinar will focus on evaluating systems change. We've got a brilliant lineup of speakers who I'll introduce in just a moment, but first I'll just run over a couple of technical aspects with the WebEx platform. So firstly, you'll notice that your microphones are muted. This is just to make sure we get kind of good sound quality for the presenters. Once we get to the question and discussion section, if you'd like to ask a question, please do just unmute your microphone so you can ask that in person. On the lower right-hand side of the screen, you should be able to see a chat box function. So if you have any kind of comments or questions as we go through, please just pop them in there, or if your microphone isn't working, again, pop your questions in the chat box and I can ask them on your behalf if you'd like me to. Unfortunately, if you're dialed in today, you won't be able to ask questions in person. So if you have got anything you'd like to ask, please just drop me an email and I can ask this on your behalf. So you should have all received an email from me yesterday, but for reference, my email address is b.collinson@sheffield.ac.uk. We'll be recording today's webinar and it will be made publicly available later today. Registration for the event, however, was closed, so it was advertised to Fulfilling Lives Partnerships and another of other programmes funded by the National Lottery Community Fund. And it would be great to know who's in the audience, so if you're happy to kind of type where you're from, which partnership and what your role is, that would be great. And we also encourage you to tweet about today's session, and our Twitter handle is on the screen now and will be on the next page. So I'd like to thank our speakers for joining us today and making this opportunity possible. To start us off this morning, Rachel Moore-Eaton, Associate Director at CFE Research, will be giving an introduction to the webinar. Following Rachel, we'll hear from Dr. Matt Egan. Matt is Associate Professor at the London School of Hygiene and Tropical Medicine. And Matt will be talking about approaches to system evaluation. Matt's also the co-author of the guidance on systems approaches to local public health evaluation, so it'll be great to hear about that work. We'll then hear from Jane Harris and Hannah Nickson, who are both senior consultants at Cordis Bright. Cordis Bright are currently evaluating both the Blackpool Fulfilling Lives project and the MEAM approach, and Jane and Hannah will be talking about challenges and approaches to systems change evaluation. And then last but not least, we'll be hearing from Hannah Mahoney, Project Manager of Golden Key Bristol, and Hannah's going to be talking us through some of the local work that's happening in Bristol and their theory for complexity. So a great lineup, and I'm looking forward to it. So with no further ado, I'm going to hand over to Rachel. Bear with me, Rachel, I'll just share the presenter powers with you. Over to you, Rachel.
Thanks, Beth, and morning, everyone. So as Beth mentioned, we originally developed this webinar in response to interest from Fulfilling Lives partnerships, but we decided then actually there'd be other fulfilling National Lottery Community Fund funded programs that are likely to find it of interest, so we opened it up to a wider audience. So welcome to you all who have come here not from Fulfilling Lives today. For your benefit, I'm going to give a very brief introduction to Fulfilling Lives, just to help set the scene and provide a bit of context. For all of those of you who are familiar with Fulfilling Lives, then just please bear with me, I will be very brief. So Fulfilling Lives is a £112 million investment from the National Lottery Community Fund, spread over 8 years. We're about 6 years in at the moment. And the overall aim is to ensure better support for people experiencing multiple disadvantage. And the Community Fund commissioned the University of Sheffield and CFE Research, who I work for, to carry out a national level evaluation of the programme. So what do we mean by multiple disadvantage? In terms of this programme, it's defined as experience of 2 or more of homelessness, alcohol or substance misuse, reoffending and mental ill health. In practice, we find that most of the programme beneficiaries actually have experience of 3 or 4 of those, as well as myriad other issues such as physical and learning disabilities and domestic violence and so forth. The programme aimed to engage those who were not otherwise getting the help that they needed. And to date, the programme has provided direct support to almost 4,000 people. The programme is delivered by 12 voluntary sector-led partnerships from across England. Some of those are coming to an end now. Partnerships cover a wide range of geographical areas, including London boroughs, such as Islington and Camden, seaside towns like Blackpool, post-industrial cities such as Stoke-on-Trent, and in the case of West Yorkshire, a really large and diverse sub-region. And in brief, the programme has three key overarching aims: to change the lives of people affected by multiple disadvantage, to change the systems that support them, and to involve beneficiaries in that work and in doing that. And I think it's fair to say to date that our evaluation has focused very much on the first of those, really looking at the impact of the programme, beneficiaries and how their lives have been changed and affected, and also how beneficiaries have been involved. So we've done much less, I think, on the systems change angle. We also know that partnerships have been sort of wrestling with how they might capture and evaluate systems change at a local level. So it seemed really timely to reflect now on how that systems change evaluation is to be achieved. A few years ago, programme stakeholders came together to discuss and try and agree a definition of just what we mean by systems change if we're going to try and measure this. This is what they came up with. So systems change is changes to people, organisations, policies, processes, cultures, beliefs and environment that make up the system. So recognising that the system is multidimensional, sort of all-encompassing really. They went on to then sort of clarify that definition a little by saying that systems change that the programme's interested in should be beneficial, obviously, to people affected by multiple disadvantage, sustainable in the long term, so continuing after the programme comes to an end, and transformational. So I think what they're looking to achieve is something that's not sort of tinkering, it's not tokenistic, it's not doing the same thing as that's always happened, but just calling it something different, and so something that shouldn't be reliant on a few key individuals. So that's obviously not going to be helpful for ensuring longer-term sustainability of any changes. I think there was also a recognition that sort of flexing the system, making one-off exceptions in individual cases, didn't feel like that was enough of a system-wide change. So it was also recognised that those sorts of changes, those flexibilities, could be useful starting points to look at wider change. So I think that's all I'm going to say just to sort of set the scene, really. But I think it's interesting, actually, after today, to be able to reflect on the extent to which that definition really works and is helpful in helping us to sort of assess and think about how the system has changed over the past few years in terms of those fulfilling lives areas. I'm now going to hand back to Beth, who is going to introduce our first main speaker of the day.
Thank you, Rachel. That's really good to have kind of a quick overview of the programme and systems change. So I'm going to hand over to Matt Egan now. So welcome, Matt. You are now the presenter, so you'll be able to control the slides from here on.
Can you hear me speaking now?
Yeah, brilliant.
Right.
Morning.
So, yes, I got it. Okay, thank you for inviting me to this. I'm Matt Egan from the London School of Hygiene and Tropical Medicine, and I guess I'm here because I'm part of a project with quite a wide range of colleagues from the National Institute for Health Research School for Public Health Research, who we've produced some guidance on evaluating on public health evaluations from a systems perspective, and it was designed primarily for people working in local level evaluation. We've also, as part of that, we reviewed, one of the things we did besides doing the guidance was review public health evaluations that were already kind of out there that took a systems perspective. So that's kind of where we're from. Where me in particular, I'm less involved in implementing systems interventions, if you like. I'm more concerned on the evaluation. what you're going to hear, if you've heard me speak on this before, you'll be having a similar set of slides. Sorry if that's repetitious. Basically, we've been thinking about how we should do public health evaluation that takes a systems perspective, and some of us on that collaboration are working on our own, and when we've made more progress with our own, we'll be able to update some slides and reflect on our own experiences on this, because it still feels fairly new to many of us, I think, within public health, even though systems thinking has a much longer history. It's, to some extent, quite new within public health. So that's a list of some of the key people who've been involved. I presume these slides will get made available afterwards. I really just wanted to start with my own introduction to the idea that there was a thing out there called systems, and you might take an interest in studying them. And for people of my generation within public health, I think that the foresight map on obesity was really the sort of key introduction to just the notion that there is this, that there are things that we can call systems. And I can remember at the time when I saw this, quite some time ago now, I shared a similar reaction, I think, to many people, which was kind of double-edged. On the one hand, I thought it was incredibly useful that people were bringing together all the different factors associated with obesity and seeing how they interconnected. On the other hand, I, probably more than most people I know, I'm not a particularly visual person, and a map like this, well, it is confusing, and my reaction to it was, you know, a kind of reluctance to look at it too much, because it was just hard to figure out what to do with it. At the same time, there was, I was aware that within complexity science and systems thinking, there was some other kind of critique of this kind of map, at least in the sense of whether or not it was displaying what you might call a complex system. And the critique was around the fact that, you know, what you're seeing here is certainly a very complicated system. It looks like a plate of spaghetti, and it's sometimes called spaghetti diagram. But was it actually complex in the way that complexity science considers it? And this is something which at the time I didn't really pay much attention to, because my understanding of systems was basically framed around this diagram. But more recently, and as me and my colleagues have started looking at the literature, we've taken more of an interest in what the more well-known definitions of complex systems are. So I thought it might be worth me discussing these with you, at least in summary. So there's a very popular definition of a system from Meadows, who's done a huge amount of good work on this. And actually, if you were to YouTube some of her lectures on the subject, she does some great lectures. They're quite old now, but they've been put onto YouTube, and they're fantastic. Anyway, the definition: a set of things, people, cells, molecules, or whatever, interconnected in such a way that they produce their own pattern of behavior over time. And I guess the main point I want to get across here is that this definition isn't simply saying that a complex system is something that has lots of elements that are joined together in a sort of tangled web or a plate of spaghetti. The idea is that this system has some key attributes, and one of the main ones is that what it means is this idea that the whole is greater than the sum of its parts. The idea that the system is an interconnected group of elements that have their own pattern of behavior. but can't simply be reduced to the actions of any particular elements within it. And a second part of the definition, which I want to draw your attention to, is at the end, a pattern of behavior over time. The idea that the pattern changes, and it's basically a moving dynamic system. What does that actually mean? Well, it could mean that you've got a system that's in transformation. It's actually changing quite radically over time from one state to another. Or it could mean that the elements within the system are changing in such a way that they stabilize each other out. You know, movement in one part of it is kind of cancelled out by another. Perhaps some simple examples might help get this across. So one which I've heard before and used before is the idea of a crowd. Imagine a peaceful, what starts off as a peaceful demonstration, where most of the people who go to it have in mind turning up to a peaceful demonstration about something, but for one reason or another, the crowd turns more aggressive and more violent and becomes more of a riot. The idea is that the behavior of the crowd can't simply be reduced to the intentions of or the actions of individuals within it. The crowd took a life of its own. Within public health, there's also a well-established understanding that population-level health issues can't always be reduced to individual-level factors, and there's various concepts that basically rely on this assumption. One of them is herd immunity, where it's not simply you know, a vaccination regime isn't simply about protecting individuals. You have to reach a certain level so that the crowd itself, so that the population itself has immunity. So anyway, that's my basic point, that a system's a complex system behaves and changes in a way that can't be reduced down to its individual properties, and that it's more than a sum of its parts. This slide basically just gets across the idea that for much of my career in evaluating public health, actually we haven't given much thought to the complexity of the system. We've tended to think more in terms of whether an intervention itself is simple, complicated, or complex. And this is a fairly well-known schematic that many of us have been introduced to, where a simple intervention is like baking a cake. It's easy to follow and replicable. And then you might have a complicated intervention that's harder to do, but still, once it's mastered, once these various techniques are mastered, you can still replicate it. And the complex intervention is like raising a child. It's hard to do, it can't be replicated, it's unpredictable. Expertise, look, personality, context all play important parts in it. So we've been focusing on the complexity of interventions, and the idea with systems thinking is, well, it's a move beyond just thinking about whether the intervention itself is complex or simple. So this is the kind of logic model that for most of my career I've been used to thinking of. It's very simplified, but basically it's kind of, it might be familiar to some of you, where if you're trying to assess what impact an evaluation has had, you often look at the resources and the intervention itself, what that intervention immediately did to the public health environment. So I don't know, I work a lot in say alcohol and the nighttime economy. So maybe the interventions to try and in some way restrict late night alcohol licenses. So the immediate output will be the licenses. And then there'll be short-term outcomes and long-term outcomes, including health outcomes. Short-term outcomes might include things like crime, disturbance, and injury, and then long-term outcomes might be more like long-term alcohol-related health disorders. So that's kind of how we might think about an evaluation if we're just thinking about the intervention itself. And here's a a diagram which I've, this is about as complex as the diagram which I like to show, which tries to show maybe what a look at a systems perspective might add to this. So here, you can imagine, or the diagram shows an intervention that's maybe had an impact on one single part of a wider system, and that part is connected to other parts of the system. And what we're really trying to understand here is not only how the intervention impacted on the specific element that it was supposed to impact on, let's say late night licenses, but how that in turn set off maybe a chain of responses from all the other parts of the system that it was connected to. And then we're also interested in whether that change in the system fed back in any way on the intervention itself, whether because the way the system changed, it then had an impact on how the intervention was implemented, how it was regarded, its acceptability, whether people wanted to see more of it, or whether there was an attempt to limit its impact and maybe prevent further interventions of that kind happening in the future. So that's. And I just wanted to show, the last diagram was showing an intervention that just impacted on one part of the system. You can also, of course, have complex interventions that try and impact on several parts of the system at the same time. It works in a similar way, there's just more arrows, basically. And I think a lot of the whole system obesity interventions try to do this. They try to target different parts of what they consider to be an obesity system. So, for example, they might look at the way unhealthy foods are being are available in the high street. They might look at what's being taught at school, what's available at school. They might target political processes. They might target several different things at the same time. My point is here that both of these things, I'll zip back, these can both be looked at from a systems perspective. Both a simple intervention and a complex intervention can be looked at from a systems perspective. This slide I just added tried to give an example that, this raises the question, well, when should you look at things from a systems perspective, and when should you consider an intervention to be complex or simple? And I think the main conclusion that myself and colleagues drew was that actually most interventions can be viewed from different perspectives, and it really depends on what kind of decision you want to inform. So if you're interested in, I give the example of streetlight dimming. Lots of towns around the country now are dimming their streetlights at night, ostensibly to reduce cost and energy use. There's a sort of financial and perhaps an environmental gain from this. And you could view that as a very simple intervention that just changes one part of the system, the lights, and perhaps only measures the immediate goals, which are cost and energy use. Or you could consider it to be a complicated intervention, because dimming those lights is actually quite a complicated thing. There's no dimmer switch on a town's lights. So you could look at the technical complexities of actually achieving this intervention, try to improve on it. You could look at it as a simple intervention with complex consequences, again focusing on the dimming of lights, but starting to see other things within the system that are important besides just cost and energy use, such as political acceptability, media and public reaction, possible unintended consequences like traffic and pedestrian injury, feeling unsafe, isolation, increased awareness of environmental issues, etc. And you can also, if you really wanted to, start to see this as a complex intervention within a complex system by looking at, say, not just the dimming of the lights, but the aligning of interests and the bringing together of stakeholders that were required to actually achieve this dimming of lights, whether any work in advance went into trying to shape public perceptions and media response and political responses to it. And so you can basically make what ostensibly seems like a simple intervention as complex as you like. The question is, well, should you? And the answer to that question, I think, is pretty much based on what decision you want to inform. If you want to inform a decision that's purely about cost and energy use, then it seems sensible to choose to focus in on the more simple side of this intervention. If you want to look at the wider issues, then it makes sense to broaden it out, and that should really depend on the decisions you want to inform. I'm not making great time, so I'm just going to quickly zip through the next few bits. What have we learned so far? We've basically been trying to get across that complex interventions are more than just a tangled set of related factors, that they're dynamic and more than the sum of their parts. That we are used, in public health, we're used to thinking about simple or complex interventions, and that really what we're being challenged to do by systems thinking is to start thinking more about complexity as a property of the system rather than just as a property of the intervention itself. Advocates for this, of which I guess I'm one, use some rhetorical devices, which I think we should be aware that they are rhetorical devices, to help us build our argument. Just because they're rhetoric doesn't mean that they're not valid. It's just a case of being clear about what they are, I guess. And part of that is to say that we have a traditional way of evaluating things, and there are limitations with that. Some of our gold standard evaluation types aren't necessarily as problem-free as we might like to think they are. And so I showed you a picture of a straw man there, because this is basically me creating a straw man out of traditional evaluation. And this slide shows what a traditional evaluation means to me. I mean, you have an intervention. Typically, you have a comparison group. You measure before and afterwards. And if you've got the resource, you do some qualitative work to look at processes and context. And here are some potential critiques or limitations to that approach. Although, I mean, traditional evaluations have been designed to try and identify and iron out certain types of bias, and in many ways, they do a good job of that. But nonetheless, there has been a sort of counter critique about traditional evaluation. Here are some of the points that have sometimes come up. First of all, they rely on this idea of an intervention as a sort of separate, isolated thing that springs up, has a definite start point. You can measure it separately from other things, and then often it has a definite end point as well. But actually, a lot of things we do aren't really like that. We have a lot of long-running services and policies that get tweaked in various ways, and they often connect in with other services and policies. So this sort of standalone intervention is itself open to some critique. A lot of evaluations, often for statistical reasons, focus on one or two primary outcomes. And if you're a public health researcher like me, frankly, you're pushed towards always looking at health outcomes, partly for funding and partly for disciplinary reasons. They're not necessarily the only or best outcomes to have for some of the sort of social interventions we might look at. Let's say housing regeneration, which is another area that I've looked at. Why should mental well-being be the main outcome on which we judge housing regeneration? Do we confuse important with measurable? So this is a critique that basically says that a lot of evaluation has tended to gravitate towards interventions that are easier to evaluate. And so the evidence base doesn't just tell us about what's effective or what's not. It tells us what's effective and measurable, which is a slightly different question. Why place such emphasis on measuring non-replicable outcomes? So this is about whether interventions can be, a lot of efforts put into getting very sort of specific, narrow estimates of effect for a particular intervention delivered at a particular time and place. But we know that many interventions will change and differ when they're implemented into different contexts. And the question is, how reliable are those initial estimates, bearing in mind that what you really want to know is how an intervention is going to fare in a different context. And finally, do we have to report findings after they've happened? And the problem here is a lot of our evaluations basically measure interventions as they take place. And if you want to know long-term effects, then you have to keep evaluating it. And the critique is, well, doesn't that mean that for some of the bigger, harder to undo or expensive interventions, then the findings have arrived too late? I've not done a very good job of keeping the time here, so I'm going to have to zip through some of these issues. Really, at some point, we're going to have to, we'll be publishing our review of systems approaches. And effectively, we found 5 broad types of systems evaluation that have tried to bring systems perspectives in different ways to public health evaluation. And essentially, what we, out of the studies we found in our review of public health evaluation so far that try to do this, we found a collection that are basically qualitative process evaluations that try and expand what they look at to consider not just what the implementers have been doing and what the immediate users of the intervention think about it, but have tried to look at other parts of the system, let's say by going up to sort of national government level or going out to sort of media level, and get a wider view of how the intervention is being experienced. So you get these sort of qualitative enhanced process evaluations, which I think still need a lot of work actually to sort of develop this more. On the other side of the scale, you've got from complexity science, you've got lots of modeling studies, usually system dynamics modeling, but there are other types of modeling studies as well, like agent-based modeling, which basically either try to predict what a hypothesized intervention's impact might be on a given population, or for an intervention that's already been implemented, try to predict what that intervention might do, how that intervention might affect a system that's based on population characteristics of a different population. So then just to kind of predict how the intervention will fare in a different time and place. Speeding along a little bit so I don't overrun too much, that slide just sort of describes this basic split between the more sort of qualitative process type of systems evaluations and the more modeling predictive type of systems evaluations. And this is the final slide, actually. So what we found from our review was that, well, 2 things, actually. First of all, we found that if you're interested in bringing systems thinking to public health evaluation, you're probably going to have to widen your view of what constitutes evaluation and not focus it entirely on impact evaluation of interventions that are actually taking place. So we kind of developed how to scale. Martin White helps lead on this particular part of our study, where you see evaluation as a kind of stage process. You don't necessarily have to do every single stage, but within this process, you might theorize the impact of an intervention, try and predict the impact of a hypothesized intervention that's not been implemented yet. Then you can do maybe an enhanced process evaluation. You can try and bring systems thinking to impact evaluations of interventions that are actually taking place, although there aren't actually, we couldn't find any examples of this when we did our review, except we do think there's 1 or 2 that are actually being done at the moment, but they haven't been completed yet. And then an evaluator could be interested in further prediction of an implemented intervention, predicting how it might roll out into other areas. And that, I've overrun by 5 minutes. I'm very sorry about that, but that's basically the end. I haven't given you a conclusion as such. I mean, basically, this is ongoing work. I think the public health field needs to give this these kind of approaches a go, and then start to feed back how we're finding the experience of doing systems evaluation in. Sorry, my phone's just gone. For public health evaluations. I've left my final slide's a plug of our guidance. That was a rush through. I'm sorry about that, but I think that's me. Thank you.
Brilliant. Thanks, Matt. Great presentation with some really useful insight, and there's been lots of interesting comments and discussion as we've gone through. One question that we've had through from Rachel in the South End. She asks, what are your thoughts on how useful are quasi-experimental methods for evaluating systems change?
So I would, quasi-experimental methods, I would like to think that they are useful. I just don't think it's been done a great deal at the moment. So the Martin White's soft drink industry levy evaluation is in progress, and he is using various quasi-experimental methods to look at systemic change from that intervention. So the soft drinks levy is obviously having an impact on soft drinks, but he's looking at how the wider system is responding to that, and he's using time series analysis and a range of other methods. I think we need to give it a go, basically. He's giving it a go. I think more of us need to give it a go and work out how useful they are and what's most useful in that respect.
Brilliant, thank you. And thanks for that excellent presentation. If anyone else has any kind of thoughts as they go through or anything they'd like to ask Matt at the end, just pop it in the comments box. So now I'd love to hand over to Jane Harris and Hannah Nickson from Cordis Bright. You are now unmuted, Jane, so over to you.
Thank you very much. Can you unmute Hannah as well, or only one at a time?
Yeah, no, Hannah's unmuted too as well.
Super.
So over to you both.
Okay, thank you. Right, so I'm going to control the slides, and I think Hannah's going to start talking first of all about some of the challenges that we've come across in evaluating system change, and then what we're going to do, if we've got time, is we're going to run through 3 practical examples of how we've tried to tackle some of the challenges and how we've tried to evaluate changing systems in practice, bearing in mind some of the difficulties and constraints that you experience in the real world in doing that. We might have time only to go through 2 examples, but we'll see how we do. Okay. I'll move on to the next slide.
Great, thanks, Jane, and thanks for having us, everybody. Just to quickly sort of give a bit of background of why we're involved here. As Beth said at the beginning, we are involved in evaluating Blackpool Fulfilling Lives and the MEAM approach. We work for an independent research and consultancy organisation called Cordis Bright, and we work across health, social care, criminal justice, children's services in particular. And we're increasingly finding that we're involved in evaluations that are either themselves aiming to evaluate systems change programs, or that are evaluating interventions that have impacts across the system in terms of affecting change on that system or trying to. And as Jane said, the first thing we thought it might be useful is to outline some of the key challenges that we often encounter in our evaluations of systems change. I think some of these challenges touch on the points Matt was making about when traditional evaluation can be problematic, and also some of the points he was making about how we conceptualise systems. And I guess lots of the challenges we encounter overlap with the challenges that are encountered by people who are actually trying to deliver the systems change. But some of them are a facet of coming in as an external evaluator, I think, and therefore joining at different points in that conceptualisation of the system and working through effecting change to it. So I think one of the key challenges that we often encounter is actually defining the system that we're interested in. So we're often brought in to investigate systems change, but it soon emerges that amongst the key stakeholders in the local area, or sometimes at national level as well, there's not a clearly defined shared understanding of what constitutes the system in question. And usually at the point that we become involved, there's also little resource, little time, and sometimes little appetite for system mapping activities that might help us to reach this understanding. So sometimes we're kind of pitched in partway through the thinking around a system without necessarily the time or the levers to do some of the groundwork that might help us to really set up something that is based on this shared understanding of the system. And I guess this definitely speaks to what Matt was talking about in terms of how we're conceptualising the systems. We're working on initiatives that are based around, say, integration or around things relating to an issue or a group of people, for example, people experiencing multiple disadvantage, who touch on a wide-ranging systems that interact with each other, but which for this purpose might be considered as one system. So that can make things very complicated. Another challenge we often encounter is isolating the impact of particular programs on the system. And this relates both to the fact that assuming that we have an understanding, some kind of understanding about that, it can be really hard to get baseline information about the characteristics of that system and its relationships. So what does the system actually look like at the start of this program? What is the starting point from which we can judge whether change has taken place? That could be really complicated for evaluators and stakeholders involved in the systems change. And that relates to identifying the best indicators and data sources, but also to practicalities around gathering data on those things, getting data at the right moment in time, so getting data that relates to the starting point for this system, but also quite a big assumption that the data that we might collect there reflects the system at this point in time. Another facet of this challenge is you would have if you're evaluating an intervention rather than a sort of systems change program, which is that there are usually a lot of concurrent activities that might be impacting on the system, and so therefore establishing causal connections between the impact that you're trying to evaluate and other things that might act upon the system can be very tricky, and it's hard to unpick those things. Thanks, Jane. One of us can control the slide, so that's why there's disjointedness, perhaps. Another challenge that we regularly encounter is working with complexity and multiple systems. And here, I think programs involving people experiencing multiple disadvantage are really so Fulfilling Lives, or the MEAM approach, is likely to involve a focus on a range of systems that interact. So as a minimum, probably housing, health, social care, criminal justice systems, but also probably a range of other subsystems or agencies in the voluntary and community sector that might be systems change or affected in an unexpected way by changes elsewhere in the system. Aspect of the complexity sometimes is that sometimes the geographical footprint of programs that we might be evaluating means they span more than one set of local systems or subsystems. So an example of that would be evaluating perhaps a program which is police or police and crime commissioner led, which relates to 4 or 5 local authority systems when you're starting to look at different, at non-criminal justice subsystems that might be affected. And another challenge that we often encounter, and this is not exclusive to systems change evaluations, but it is a facet here as well. And we're often brought in programs that have really ambitious systems change aims, which we, from the outset, know, and which often from the outset stakeholders also accept, are going to be very difficult to achieve in the resource and timescales for the programme. So although some system change might still occur, even as a consequence of a simple intervention, but the aims of the programme sometimes mean that if you focus on what have been outlined as the initial aims of the programme and the intended outcomes, you can sometimes miss important changes that have taken place that were more realistically achievable within the timescales. So it's really important at the beginning to unpick those initial aims and to reach a sort of shared understanding of which elements of those might be visible in this evaluation period and within the methods that you might be able to use. And if those things aren't going to be visible, what other things might be visible and useful to understand in and of themselves, or because they might be a sign that you're on the trajectory towards those longer term and bigger changes that might not be achieved in the timescales on the programme. So those are some of the key points that we think we encounter, and as Jane said, we now have a few examples of some evaluations that we've undertaken, and I'm going to hand back to Jane for this example.
Thank you. Thanks. Okay, so our first example is the evaluation of the Greater Manchester local care approach, and this is, I guess it's what Matt described as a qualitative process evaluation of what's happening in 7 local areas in Greater Manchester. So system change is happening at a big scale across Greater Manchester, so it's across public services and it's across the wider economy. And the overall aim of that is to tackle all the reasons why the population of Greater Manchester experiences worse health than people in other areas. And so it's to do with individual behaviour and lifestyle, it's to do with the way that services are delivered, it's to do with how the economy is set up, and a whole range of factors that all interact together to affect the health of the population. Luckily, we're not evaluating all of that, and we're part of an ecosystem of evaluation, and our evaluation looks specifically at how localities are joining up their health and care services to achieve a better experience and better outcomes for local people, and they're calling that the local care approach. To make matters more complicated, we're only doing that in 7 of the 10 areas that make up Greater Manchester, because 3 of them already had their own evaluation plans when we were commissioned by the remaining ones to do this. So that's what we're trying to do. And although it's billed as a process and impact evaluation, realistically, it's a process evaluation with some indications of intermediate outcomes or impacts, because the real change that we expect to see from having a new approach to health and social care locally will only happen over a very long period of time. And that's one of the big challenges for system change in Greater Manchester is that there are national indicators which NHS England and sort of the wider world takes notice of, which will only be affected over a very long period of time. And so it's not easy to judge the success of devolution over a short period. So our qualitative work will, we hope, contribute towards showing that that is moving in the right direction, if it is. So again, some of the challenges, we're always carping on about challenges, but what we try to do is work around them in practice. And one of them, and a key one really, is that the local care approach, in theory, ought to be perhaps a replicable approach. So maybe something quite complicated, it's got several different components, but it could be easily replicated in different areas. And in practice, that's not the case. It's complex because it depends not only on structures like a provider alliance or an integrated commissioning organisation. It depends very much on local relationships and on the quality of leadership or the nature of leadership, the history of what's gone before, how the population is likely to receive change. In some areas, people are much more open to it than they are in others. And what's happened is that in the different localities, that local care approach has developed completely independently and at different speeds. So we're evaluating things which look quite different in different areas. And then also the areas have had what's called transformation fund money to help towards that. So so they've all had money to do things which are about shifting, largely about shifting the focus of health and care from hospitals into the community and into people's own homes. So there was a question about are we only evaluating that money and its impact, or actually about all of the effects that's had and all of the activity that's happening to do that. And at the outset, there wasn't a clear link between the activities that made up the local care approach and the intended changes in the system. So in some cases, it wasn't clear how what was happening would contribute towards the changes in health outcomes, for example, that the system wanted to see. And so one of our ways that we've come up with to try and deal with this is to develop a thematic approach to the evaluation. So what we've done is develop a set of themes that guide the evaluation. So for example, all of the interview topic guides, the questionnaires, the focus group guides, all the workshop plans reflect some or all of the themes that we've worked up collaboratively with the Greater Manchester Central team and with the local areas. And all of the evaluation reports that we produce for each of the local areas and the overarching ones for the whole of Greater Manchester, they are also structured according to these themes. So what they aim to do is to distill the reality of a complex system and transformation across GM into something that is much simpler to get to grips with. And I'll show you what I mean here. So these are our system change evaluation themes. So they reflect the elements of the system that the sort of all the stakeholders in Greater Manchester agree that they want to change or affect. And three of these are about processes, I guess. They're about structures, governance and accountability, leadership and relationships, and about the process of developing a local care approach and what that looks like and what the experience has been like and whether it's worked out to plan or not to plan. And then within that, we've got a whole number of areas of sub-inquiry there. And then three of them are about impacts. And I think it's really important to say here that we are not doing quasi-experimental work, or we're not doing quantitative work to try and demonstrate those impacts. So most of our work focuses on sort of intermediate progress towards achieving those and perceptions of how that's going and why that's working. So for example, when it comes to impacts on the workforce, we've developed a workforce questionnaire which asks people about their perceptions about morale, relationships, work culture and all of that. And that sits alongside some work that the University of Manchester are doing. And they are doing some quantitative analysis of a set of outcomes indicators that will hopefully demonstrate the impact of devolution on population health. So that's a separate but complementary piece of work. So our work is meant to throw light more on the how and the why and how the real world has impacted on progress towards achieving those impacts. So in terms of the sort of benefits of working out a thematic approach, it kind of means, I think, that the evaluation is more than the sum of its parts. It's not just a set of individual evaluations of what's happening in local areas. It can be pulled together to look across the 7 areas to see where there are commonalities and where there are differences, and where that yields some learning about implementing a local care approach and how that works. It's actually been taken up also now by the 3 localities that weren't part of the jointly procured local care approach evaluation, so it's useful across all 10 of the local areas, and it's being used to begin to evaluate the response to the COVID-19 pandemic. So at the point when lockdown happened, we had just delivered our interim evaluation reports with formative reports, and now we're shifting to because it seems nonsensical just to plough on with what we're doing in the light of everything that's happened. So we're now shifting our focus to look at how integration of health and social care has responded to COVID-19, and we're using that thematic approach to do that. And we hope that that will help in the progress towards post-coronavirus recovery. So that's a very quick whistle stop. There's a lot more to it, but I thought we would focus just on the thematic approach and how that's helped to try and simplify some of the complexity that's involved there in evaluating the change. And Hannah is going to talk about the evaluation of the MEAM approach.
Thanks, Jane. So in this second example, we've tried to hone in a little on how we're trying to explore changes in attitudes and relationships as part of this systems change focus. So in particular, just recognising that people are a key part of the system, and therefore that we need to understand what's happening for people in the system if we're going to see whether the system is really changing and changing in the ways that the MEAM approach would like it to change. So I'm not sure, I know quite a lot of people are from a kind of multiple disadvantage background, and so I don't want to dwell too long on what the MEAM approach is, as I think people might already know. But we are the national evaluators of the MEAM approach, and it's a 5-year evaluation of the rollout of this approach across a number of local areas. So the approach is a non-prescriptive framework with a set of 7 principles that you can see here, which aim to help local areas to structure their thinking and their activity around improving support systems and outcomes for people experiencing multiple disadvantage. At the moment, it's operating in 31 local areas, and we're in the 3rd year of the evaluation. That's likely to increase further over years 4 and 5. And at the beginning of the evaluation, so in year 1, we work with stakeholders within MEAM, with experts by experience in some of the local areas where the MEAM approach is being delivered, and with staff and other stakeholders in those local areas to develop a theory of change for the MEAM approach, and then an evaluation framework that fell out of that. So we honed in on 3 key ultimate goals that people think that the MEAM approach is trying to achieve. So one of them in the centre there is around improved outcomes for people who are experiencing multiple disadvantage, so people achieve their goals and improve their lives. And the mechanisms by which that is intended to be achieved tend to relate to services and systems. So there's services and systems and people involved in them working better for and with people facing multiple disadvantage. And then there's also systems and people supporting people who are facing multiple disadvantage, are using available resources efficiently and avoiding unnecessary costs. So there's a sort of saving economic benefits component as well, which is a longer term through the changes to services and systems that are for the benefit of people experiencing multiple disadvantage. And then I thought I'd just hone in on a couple of the methods that we've tried to use to take a sort of systems change perspective. And I think in relation to what Matt was talking about, this is very much a kind of qualitative research or relatively traditional evaluation methods with a systems focus, rather than some of the things at the other end of the spectrum on Matt's slide. So the first element that I thought it might be useful to talk about a little bit is a cultural values survey that we've developed. And the idea of this is that across all of the areas involved in the MEAM approach network, we would circulate this survey on an annual basis. So for those areas that have been involved from year 1 of this evaluation, we will have 5 years of survey data by the final year. And the survey aims to identify changes in attitudes and practice in person-centred care, trauma-informed care, and multi-agency working in all of the areas in the MEAM approach network. And the reason for this is we're focusing in on types of behaviour and support provision that are known to be linked to better experiences and potentially better outcomes for people experiencing multiple disadvantage. So we developed a survey which is based on a range of pre-existing validated scales that focus in on these things. So, for example, in relation to person-centred care, there's a specific person-centred care assessment tool which has an agree or disagree scale for a number of statements which help to unpick people's attitudes towards person-centred care. And so an example of a statement would be, organisations or structures in my local area prevent staff from providing person-centred care. So we're trying to hone in on how people view local processes, structures, systems, attitudes in relation to these types of support provision, which might be of benefit to people experiencing multiple disadvantage. And one of the benefits that we see of this method is that, as I've said before, is that it recognises that people make up the system. It's not just the processes. A second key benefit for us is often in this type of evaluation, we might find that we have most access to people who are quite closely involved in the programme that we're evaluating. And therefore it can be difficult to understand what wider agents within the system might A, think about the programme and its impacts, but B, what impacts they themselves might be experiencing that are linked to this work. So the advantage of this survey is that it can be circulated widely across a range of agencies and actors in the local networks that are delivering the MEAM approach to understand whether impacts are wider reaching or whether they're remaining sort of relatively focused on the specific programmes of activity that might have been being developed and delivered by the MEAM approach work. And the second example is around again, it takes a thematic approach that, Jane, could you just shift the slide on, please?
Oh. Has it not gone on? I thought I'd just done it.
Oh yeah, it has now, sorry.
Yeah, bit of a time delay.
Sorry about that. So the second approach is a similar kind of thematic approach to the one touched upon by Jane, but it's hones in on an individual theme on an annual basis to try to unpick that further. And this is very much qualitative research that tries to consider systems elements. So, for example, this year we've taken a theme of partnerships in the local areas, because we understand that there are partnership structures and systems that have been either introduced or further developed by local work using the MEAM approach in order to support delivery of that work. And what we'd like to do is unpick this a little more to understand them better and to understand whether and how they're supporting effective delivery of the MEAM approach and whether they are affecting system change in any way. What we've done as part of this research this year is combined observation of partnership structures and processes in action, so usually attending strategic partnership meetings and operational partnership meetings relating to the MEAM approach work in a specific set of local areas, and also a number of interviews, qualitative consultation in each of the sites. We've chosen 5 sites which are examples of where things are thought to be working effectively under the MEAM approach, or where different or innovative approaches were being taken, so approaches that we think are not happening across the MEAM approach network as a whole. And the benefits of this approach, as we see it, are that it enables us to ask questions about those structures, the relationships, change, and any outcomes of this change, but also that it provides an opportunity to focus in depth on a small number of similar systems operating in different local contexts, meaning that we can do a little bit of comparative work around similarities and differences, or what's working well or less well in different areas. Then triangulate with more limited information that we have across the network from a smaller set of interviews with key local players in all the areas in the MEAM approach network. The benefit we found is just that observation, see those structures and relationships in action, which takes us beyond gathering, which again takes us away from the risk of sometimes that echo chamber that you have where you're speaking to people who are regularly involved in delivering something, asking them about their opinions and their experiences of it. And we're bringing in a kind of slightly more objective and comparative element by introducing that observation across the areas. And I think I'll stop there because we're also right pushed up on our time, I think. So I think we've got a third example on our slides, which you're welcome to go through. And if you have any questions on any of this, then just come back to either me or Jane, and we can either help you or point you in the direction of someone from the Cordis Bright team who can. And I'll hand back to Beth now. Thanks very much.
Brilliant. Thanks ever so much, Jane and Hannah. That was really insightful and useful to see some of those practical examples and challenges that you face. And that's definitely been reflected in the comments as well, so thank you. And we will make the slides and this recording available to anyone after today as well. We've got about a minute. If anyone has any questions, please do shout up. So thank you ever so much. I'm now going to hand over to Hannah Mahoney from Golden Key, Bristol. So I'm just handing the presentation to yourself, Hannah. And you are now unmuted. So over to you for the final presentation.
Thanks, Beth. Would you mind just reminding me on timings?
Yeah, you'll have 20 minutes to present and then until 12 for questions.
Lovely, thank you. Bear with me whilst I share my screen. Can people see my screen?
Yeah, I can, that's perfect.
Great, thank you. So my name's Hannah Mahoney. I'm the programme lead for a Fulfilling Lives system change programme. We're based in Bristol. We are a partnership-based programme. We've got a big partnership, and we, for the last few years, have been paying particular attention to the systemic change approach of this work, noticing early on that whilst members of our team were able to make a positive change on the individual level, we realised that in order to embed that change and to influence wider change, we needed to take a different approach. It was an interesting time. It's actually really challenging to help a whole system with a lot of additional pressures pushing onto it. To think systemically, or even to be able to have the time as a group to sort of take a balcony perspective sometimes, primarily because that's not the nature of the systems that we're working in. And we realised, the partnership board and I realised that we needed a product that helped us bring together our thinking and that we could use as a tool to conceptualise the work. And what you can see in front of you is what I'm going to go through now. It's our approach to change. We engaged with a range of partners across Bristol to develop this. This is primarily a strategic tool, so it was primarily sort of heads of organisations, leaders at the council, and criminal justice health agencies who were involved in the development of this. And we ran a series of workshops across the course of a year. It took a lot longer than we expected to develop, and we had a consultant working with us who specialised in creating products, which is why we've got something that looks nice at the end of it. One of the other challenges that we found, which I think has been mentioned by Jane and Hannah, is that it's really challenging to evaluate system change, primarily because, again, as Jen and Hannah mentioned, you need to be visionary to drive change across whole systems, but then how do you log the small change along the way? So we also wanted a product that would help us conceptualise that to some extent. One of the other challenges we faced was that operationally, well, it's the usual theme. People coming to a board will drop in after 3 months of probably not thinking too much about it, and will need to be brought up to speed again. And when you're looking at system complexity and this type of work, that's a really challenging thing to do, and all of our members have reflected that's really hard alongside their day job. So this tool was to help support that thinking as well. I do want to mention that our aim wasn't to create something that could be dropped in on a table without any additional narrative. That's not what this is, and it's not a one-size-fits-all, and it's an iterative document, so we plan on reviewing it and reflecting on it every year and updating it. It's just we needed to draw a line in the sand, and this was where we got to with it. And already I've got notes to myself around changes that I want to make where I think we've missed things, but it has been useful for us to help people conceptualise system change. So I'm going to just focus on the details of this product. This actually, it can't be printed on small paper, so whenever we use it, we have wall-sized banners that we use. It's just not a particularly user-friendly tool, but we didn't find a way to conceptualize the systems or the complexities of a system in something that was more user-friendly. And in a way, personally, I find that useful because I think reducing things down to really simple narratives or linear processes is actually unhelpful when we're dealing with complex systems, and that we need to be given products that reflect the complexity of the system. So bear that in mind if this is a bit confusing, but I'm happy to accept feedback on that as we go through. So I'm just going to zoom in on our first section. So these are the questions that we came up with when you have a group of people in a room together who want to achieve something but perhaps don't work together all the time, who aren't a pre-established team. These are the questions that we need to be asking ourselves and each other in order to achieve an overarching purpose to work together towards a common goal like system change. I'll run through some of the questions just to give you some examples. I'm going to try and focus on some sort of particularly tricky ones, the ones that we've found tricky. So the bottom left one is, where does the power lie when creating change? This is a really tricky question, and it's often, we've run events across the city and across the area, just launching this approach to change and talking to people about how they might use it and getting some feedback in order to adjust it. And the area that we often do sort of workshop style sessions where we put these questions on tables and people are asked to gather around the table that they find interesting. And the poor power question table is always the empty one that's left on its own. People don't seem to want to engage in that, and I think that just is indicative of a wider challenge in the system about where power is held and how we distribute it in order to make change happen, because we've recognised that power does need to be distributed in order to do co-production properly, and in order to make change happen you need to be able to have as many people working across the system to a common goal as possible, and they need to have autonomy and some power to be able to make the change that they see as necessary. So thinking about power is a really important starting point. The other table that often ends up quite lonely is what is the state I need to be in the table. And this is probably a reflection of the nature of the systems that we work. People are commissioning and tendering processes tend to be quite reactive. The way we work with clients tends to be quite reactive. It's hard to get ahead of ourselves with the funding, with the nature of the funding. And actually it's quite hard for people to reflect on the state that they need to be in order to make the change. And I'd probably say that this is the first fundamental question that everyone should be reflecting on and thinking about before they walk into a room and try and do this, because I'm sure everyone's experienced a range of people sat around the table agreeing that they want to work in partnership, but then that's not really reflecting the actions of the organisation that they lead or day-to-day business, because that's been lost. So thinking about the challenges that I might face if I want to start system change, the changes I might need to make in my organisation, they all start with me, or even just shaking off the last meeting that I've just rushed from to get here, or reading the papers in advance. All of these things are just really important to be able to do these things well. So in terms of this section, we're now testing how this can be used at the beginning of any problem or partnership. So for instance, our board and I have been reflecting on COVID and the systemic leadership implications of COVID and how we respond during this time. We've got a list of challenges that's come out of that discussion, and we're using these questions to try to address those challenges in the system. And we're running a series of surgeries for people to spend time thinking about those challenges in relation to those questions, as an example. Okay, moving on. This section is about culture, fundamentally. Alongside these questions, we can't make change happen without creating the right environment. And this is by no means an exhaustive list, but these are some of the things that we need to be thinking about if we want to create the right environment in order to create change. All too often we find in a reactive environment, what we want is to rush to solutions and actions, and I think that's replicated everywhere. There's a pressure on the system to have things done, have targets, and achieve them. And actually, when it comes to system change, that's counterintuitive. We need to focus on the culture of the system and how we are interplaying with the culture in the system, or how we're modeling the culture we want to see in the system. And sometimes that doesn't mean doing, it means stepping back, taking a different perspective and thinking about the variables, which I think is very hard to do. Take COVID as an example, in an environment where you have to move 300 people off the streets into hotels. It's very difficult to spend time reflecting in that space. But it's those times when we're likely to make mistakes that don't support a system improvement approach. So we want to, in order to create the right culture, we need to respect and understand the pressures on the system. What we find is in reflective spaces, just acknowledging that the people around the table have these pressures helps to relieve the anxieties of the people around the table who are behaving in certain ways because of those pressures, and it helps move conversations along. We need to be focused. Following the under the path, you'll see a few words that are just the things we need to bear in mind as we move through these processes, which is remember to be enabling, remember to connect, have compassion, to be supporting. I mean, that's all very current, again, with COVID. These are the things that I and my team have actively had to remind ourselves to do when we're under a lot more pressure and doing a lot more things, is just to remember to be compassionate. We're all in the same situation, and we need it particularly more so now because we're more likely to be reactive because we're under more pressure. So compassion is even more important. So this is not conclusive. You probably ideas about what might be included in this area, but there's these checkpoints in this process as well, which is for people having a think on the left-hand side there. We need to think about if we're going down a road of action. We need to think about what we're learning. Are we growing a trusting relationship, and what does a healthy system feel like? And if any of those questions jar with our current reality, we need to hop back to our previous questions. And the idea of these questions is that you can return to them, reflect on them, and if something's not working, you should be able to resolve it by returning to these questions. So they're not just a starting point, they're something to return to time and again if you feel something jarring in the work that you're doing, or if you feel like you just need some time to reflect. Finally, this is our attempt at what a healthy system looks like. I will say that even though this process took a year and we had huge amounts of participation in workshops, meetings, a lot of time was spent on the first two areas, and this one was probably the least developed, and there's more work to do on it. However, we are still testing it to see if it might offer an opportunity for us to use in evaluation. So if we're looking at what a healthy system looks like, we wonder if considering whether sectors or systems have built in space for reflection, that would be quite easily quantifiable. That's a nice number. Whether there's a flexibility of approach. That's more of a qualitative research area, but we think that that's still manageable. Same with parity of power. So these are the things, the indicators we think you should be looking for to indicate a healthy system. And if you haven't got these indicators, then there's a question about how healthy the system is. Our evaluation team, the University of West of England, have taken a similar approach to the one Jane and Hannah mentioned to kind of structuring the evaluation, but they're building these findings into that to identify if we have a healthy system. And when Jane and Hannah were talking about the cultural values survey and the thematic research, I could conceptualise building those into this or this into that. It felt achievable. And actually, when it comes to the evaluation around our systemic approach, our system change approach in the past, it's often felt quite inaccessible and unachievable. So that feels like a good sensitivity test to me. So that's a whistle-stop tour. Really, we could have done with a lot more time on this, but that's it really. And I'd like to leave some time for questions.
Brilliant, thanks Hannah. And what a lovely visual. I think given how kind of complex the system is, which is something that we've all kind of acknowledged today, it's great to see that kind of mapped out and just to kind of provide a base for how we might start to explore some of this work. So open to questions now, and please do unmute yourselves to ask questions in person or pop them in the chat box and we can ask these on your behalf. We have just had a question come through from Kirsty, so I'll start with that. She says, do you have any thoughts on how the need for changes to operational ways of working enforced by COVID could be capitalised on to improve openness to broader systems change or to overcome the barriers to genuine partnership working? And that's from Kirsty from the Early Action System Change Partnership.
Yes, it's a large part of our sort of strategic priorities at the moment. I guess the key areas for us, but I do think this is locality specific, so it would depend on what's available and what the opportunities are in your area. For us, we've seen a significant change in partnership linked with some of our key partners who we've worked with for a long time, but really they've held some skepticism around the systemic approach and some caution really, because we've never had the opportunity to thrive with them as we have now. So we've been involved in setting up the hotels, which has meant the local commissioners have, and we were able to respond very, very quickly, and we were able to maintain a systemic approach whilst doing so, rather than some of the issues that come up when people are doing things very quickly is we stop doing co-production, we stop doing systems thinking, we stop thinking about EDI, but we've responded and we've made a point of maintaining those structures, which has built the confidence of our commissioners and creating a new type of relationship with them. So now we're capitalising on that in order to share learning across the hostels, across the city, so that we can capitalise on learning. So I think it's very much being responsive to the opportunities in your area and having a strategic focus so that there's, that filters down to creating space for people to continue to focus on systems change. So we've been monitoring our staff who have been involved in the work and making sure they still have space for systems change, maintaining those structures. Again, that's another thing that I think gets lost, or that is easily forgotten or dismissed when we're so busy. But actually, we've tried to do the opposite of that. I don't know if that answers your question.
Brilliant, thanks Hannah. And we've got another question coming from Kerry. Kerry asks, why do you feel people are unable to articulate where the power lies in partnership working?
Well, I think it's because, sorry, I've got an interloper, I've got a small child walking into the room. I think that's a tricky question, but I do believe that there are system pressures that people in positions of authority that drive them to have to make quick decisions, and that's about our reactive environment. And those quick decisions require sort of quite a lot of power to be able to just get things done quickly. And if you were to remove some of that power to distribute it out, I think it leaves a bit of a gap about how people can get things done quickly when they need to. For example, applying for a big funding thing that, you need a week to do it, this happens. So I think there's a lot of system pressures that drive those behaviours, which makes it difficult for people in power to relinquish power.
Brilliant, thank you. And there's lots of interesting discussion and comments coming in, so thank you for that. We're just trying to I'm trying to skim through it as we go. I'm going to go quiet for a minute because I realise as I'm chatting and people won't be able to unmute themselves if they do wish to ask a question. So over to you, attendees.
I actually can't see the questions.
If you click on if you hover over your screen, Hannah, you should be able to, there's a blue button with like a speech mark or speech bubble. You should be able to click on that and the chat box will come up. So loads of comments about how great your visual was. Hannah's just saying that she thinks rapid real-time evaluations are really helpful to capture learning about what changes have been made, how they were achieved, and what might be worth maintaining or building on post-COVID. And she's got some information that she'll circulate with me after, which is great. So thanks, Hannah.
Right. Oh, go ahead.
Unless I don't want to interrupt anybody else, it's Matt. I was thinking about how COVID is going to impact on just about every evaluation or any activity that's currently ongoing, and it does occur to me that COVID is an extreme example of something that happens anyway, which is external events of one kind or another impacting on what people are delivering and how people are responding to it. And it does strike me that a systems approach could help encourage people both delivering and evaluating it to really start to see those external events that impact on what you're doing as part of what typically often happens, maybe not as extreme as COVID, but there's often things that happen that suddenly sort of change the goalposts or change the context in which you're delivering things. And so I think in some ways it's an interesting test case to just start to consider exactly what the impacts of COVID are and other things that happen. That and how the delivery either adapts or doesn't adapt or is able to deal with these external events.
Yeah, definitely. There seems to be lots of kind of flex in the system at the moment. It's really interesting to see how some of those kind of system change goals or aims have maybe become slightly easier or achievable in these times. So we'll have to see how things develop. Jill has just popped a comment saying she's agreeing and thinks we can learn a lot about how our systems respond to COVID. Hannah, we've got another question come through from Fiona. Fiona's asking, what are your thoughts on how the tendering model impacts on partnership working?
Well, I've got lots of thoughts on that. The National Lottery Community Fund, they fund our programmes, have taken a very different approach to commissioning, and I've been urging them for some time to kind of package that up and frame that to allow other commissions to think about how they do things, because the flexibility we've had from them has allowed us to achieve what we have, and we wouldn't have been able to achieve it if we'd have been commissioned more traditionally. For example, we've been able to move money from year to year in a way that you often can't with particularly local authority funding, and that's been significant. It's meant that we can use the money appropriately, and I have run services where you're doing some quick spending at the end of the year, not things you necessarily need, but because it's there and you don't want to lose it. So yes, the tendering, the way we do tendering needs to change, if we want the system to change. It's a bit of chicken or egg about which one happens first, but it definitely drives reactive behaviour. And as an example, the MHCLG funding that comes down needs to be spent within a few months. As a sort of government response to homelessness is always really, really challenging, and creates challenging all the way down to the delivery models and how you come up with clients. So it really does have an impact.
Thank you, Hannah. I'm conscious we're getting towards 12 o'clock, so it's approaching time for us to wrap up today. I'd like to say a huge thank you to all the presenters. It's been really insightful, and I hope everyone's kind of taking something away from the session. As we speak, I'm just going to pop people or the presenters' email addresses in the chat box, and I'll share these via email as well. So should you have any questions for any of us, please do get in touch. Thanks for joining us and kind of making this possible, and yeah, just engaging in such an interesting discussion around this. So all that remains for me is to say thank you for joining. We'll share the content from today later on, and we'll make the webinar recording available as well. So I'll send this round via email, and please do follow us on Twitter. Our Twitter handle is @FL Evaluation. And that's everything from me, so thank you ever so much.